All right, this next lecture we're going to talk about colic, and just quickly, when deciding what to present in this class, I always try to think, how am I going to make these animals' lives better and their owners' lives better? And two areas I thought that were important was laminitis, which we've already covered, and the other was colic. So I felt it was definitely worthwhile to take a few minutes to kind of talk through colic and give you some management tips on how to limit colic in your animals. And you can read the definition right there, digestive disturbances with different causes. And the key is that this is going to affect about 10% of all horses, or all equids at some point in their lives. They're going to have some bout of colic. And the thing is with colic is it can result in death. So it's a very serious disorder that, we need to pay attention to, we need to pay, our management with. Now, why do we have instances of colic? Again, remember, going back to the anatomy of the animal, they're built to eat small meals all day. And what we've done is we've confined them, so we've limited the amount of exercise they get, and we feed them, typically 2 meals a day, 1 in the morning, 1 in the evening, because that's easiest for us. And that's why we start to see the incidence of this a lot higher. Now, I'd like to take this, study from Canada, and this is a 10-year study from Western College of Veterinary Medicine in Saskatchewan, and they have documented their cases of colic from 1992 to 2002, and they're listing there, as you can see, the top 9 types of colic that they see in their cases, and the largest one was impaction, followed by displacement and spasmatic, and those are the 3 that we'll really cover in this lecture, and then you can read up on some of the others to see what they are and how they come about. But the bottom line is, this does affect horses. Now, impaction colic is kind of what people think with the typical colic, and this is where some portion of the intestine, could be small intestine too, or large intestine, this is the colon that you're looking at of a horse, and it becomes impacted, and the feed just keeps backing up, backing up, backing up. It's not digested, and it results in this very painful condition, and then you start to get, the lining of the intestine starts to die off, and you can see that highly inflamed area with all that feed stuff just stuffed in there like a big sausage. It's just really terrible condition. Now, what can cause that? It's not just feed. Things like sand. So sand colic, especially here in the state of Florida, we have sandy soils, and horses, if they're eating off the ground, they'll ingest some sand, and then that can build up, and they get this large, bag of sand. It would look like that, but it'd be full of sand. So one of the things you can do is keep your feet up off the ground with sandy soils, or put it in, some type of container, horse feed, bin or something that they can eat out of, or dish, so they're not ingesting that sand. Worms, if you don't deworm your animal, they could get worm buildup in their stomachs, and they can get blockages with that, and then also undigested feedstuffs. Now, the good news about impaction colic is that the frontline defense of really any colic is mineral oil through a nasal tube that a veterinarian would come in and stick the nasal tube in, that would go down to their stomach, and then they would pump them full of mineral oil, and that's in hopes of loosening up that impaction and allowing everything to pass through. Very rarely, like in this instance, in this image, does it result in surgery, but it can result in surgery. Now again, when we go back to our anatomy, we have these twists and turns in the digestive tract, and so when we feed these large meals, large amounts of hay, large amounts of grain, when it gets in there and then can get stuck at these twists and turns. So you can see, these sites, you can just imagine, like there at the pelvic flexure, which we've talked about before, it can get stuck there, and then you start getting the buildup of all the feedstuffs, and everything backs up. Now, colon displacement is also called a twisted gut, and this is where the organs get abnormal position in there. So again, very painful condition for them. And other things you'll hear it called as volvulus. That's intestine twists or torsion. And typically these are going to have to result in surgery, where they're going to have to go back in there and rearrange the digestive tract. And I guess I'll say it here. I've sat through a couple colic surgeries when I was an undergraduate, and I'm amazed at the skill of these equine surgeons. They are just it's amazing to see them pull out these digestive organs, find the impaction site or find where the colic is, fix that area, and then I just watched them, I mean, almost just shoulder deep in replacing all of these digestive tissues. It's just it was an amazing experience, and I was just amazed at how well these veterinarians can do that. Very, very talented. Now, another type of colic is spasmodic colic, so you're getting muscle spasms in the digestive tract. So their smooth muscle, which lines the digestive tract, is just spasming. So again, very painful due to some irritation in the gut, and not a nice condition for these animals. So again, like I said, there's other types of colic that you can go look at that list and kind of, look on the internet. Like a lipoma is kind of a growth that kind of strangulates part of the digestive tract. So you can kind of see the differences with that. Now, what are some signs of colic? And I put this first because we're going to jump into this more next week when we get into equine health. But things you're going to see is their heart rate's going to increase, their temperature is going to increase, and then just some external signs. They're going to be really sweaty. So here you can see in this animal, this is an animal suffering from colic. They're really, really sweaty. They're going to be pawing the ground a lot. And then this violent rolling, which you'll typically see them do too. They're in pain, so maybe they're trying to think I can rearrange everything or try to get that, impaction out on my own. And one of the cases that I saw, I was driving out to pasture to get some mares up, and our pastures were a little overgrown at the time, and I saw what I called it a crop circle, because the mare had violently rolled in a circle continually, and she got up, and I instantly knew she was suffering from colic. It could have been something else, but that's the first thing that came to my mind was colic. So, got the veterinarian out there, treated her, and she was fine. And then a couple other signs of colic is this abnormal stance. So here you can see this animal stretching and won't move and is just in pain and doesn't know what to do. And then the other most common type thing is nipping at the sides here. So there's a painful area there in their gut, and they tend to nip at the sides. And you can see, I always say tufts of hair. You can see the tufts of hair where they have been nipping at the painful areas. So what do you do if an animal is suffering from colic? Well, initially the severity is going to dictate how they're treated. So if you notice your animal's violent action, again, like I talked about, that horse had been rolling and rolling and looked like a crop circle, looks in severe distress, you want to contact your veterinarian immediately and get them out there to treat your animal. Now, if it's mild, you can do some of the following things before you contact your veterinarian. So check the temperature, respiration, and heart rates. You're going to check capillary refill time. So what you do is stick your thumb or finger on the gums, and when you do that, you'll see it will be white for a second, and then it should refill relatively quickly. Those capillaries fill with blood, so that pink color should come back relatively quickly. If that's slow, could have some circulatory problems. Notice, are they eating? Have they defecated recently? And have you changed anything? Sudden changes to how you feed them, management, any type of medicine you've given them can indicate that they could be suffering from colic. So gather that data, then give your veterinarian a call, and then they'll be able to advise you better on what to do. Now, like I said, the frontline treatment of this, and they call these medical colics, and typically you see it with these impactions or inflammation, is doing this nasal tube. So here in this image, you can see them inserting a nasal tube in this animal down into the gut, where it will, they can pump in oil, mineral oil, to help lubricate that system. You may give pain relief, but only do that first, unless do it after the veterinarian tells you to. And they may need an IV, especially if they're not drinking. They could be dehydrated, so they may need fluids to be replenished. Now, in these surgical colics or more complicated impactions or displaced colons and things like lipoma and other strangulation lesions, other types have to require in surgery. And this is when the animal is not getting better over time. The veterinarian come out, done a farm call, had tubed the animal, not doing well, getting worse. It's going to result in a surgery, which can be very expensive. So, some of the things to note is the earlier surgery, the better for their recovery, their better chances of survival. Again, be very careful with pain medication. I would only do it under the advice of a veterinarian, because it could mask their pain. They could be in severe pain, but if you give them enough pain medication, you may not be able to notice those symptoms. Now, this is taken from that study from Canada again. And I know this is a busy slide, so I just want to highlight a couple things. This is the first thing to take into consideration is typically, like here at the University of Florida, we only see the worst cases typically. So we get referrals to the veterinary school, so they're seeing the most difficult cases. So a lot of these colics that they saw up there could have been the more difficult ones. But it was interesting that this is one of the few studies I could find where they actually had some really good data. So the surgical cases of all the animals, they had 277. So 277 over 10 years were referred to for surgery. Now of those, about 46% were euthanized before they even went into surgery. Could be the owner couldn't afford it, or the animal was just in too much distress, and before they could or even withstand surgery, they were euthanized. So that left it about 151 that actually went into surgery. Now you could pause the video and look at the differences. I'm not going to go through all of these. What I really want to kind of show you is the amount of animals that actually got discharged. And so that was about 80. So out of the 277, 80 actually went, and let's see there, I'll stand to the side, sorry about that. 80 actually were discharged and went home. So surgical colic obviously isn't ideal, and this veterinary school is probably seeing the worst cases. So the percentages may be better where, and I would talk to your veterinarian if they do recommend this. Now, how do we prevent colic? One of the biggest things is always feed at regular intervals. If you feed at 8 a.m. in the morning and 8 p.m. at night, always feed at 8 a.m. and 8 p.m. Always keep your same interval. It's when you mix it up or you skip a feeding, that's where you're going to increase your incidence of colic. Now again, if you could feed an animal 5 times a day, or even, I always recommend owners, if you can go to 3 times a day, that's better for the horse and will help limit some of this colic. Always, always, always feed quality feed to horses. Never feed moldy hay or old feeds. Horses are not like cattle or other ruminants. They typically can get away with feeding some of these, moldier type feeds or maybe not as high quality feeds to the ruminants because they have bacteria in there that are going to help break it down and digest that feed. Horses cannot. They don't survive, or they run into a lot of problems if fed really poor quality feed, and that's where it runs into things like colic. So always try to feed your animals quality feed. Exercise, again, reminder, they need exercise daily. And another tip is to never feed more. For an average size horse, the rule of thumb is about 5 pounds or 2.2 kilograms of grain per meal for an average size horse. But if you really want the rules, especially for the other equids that are smaller, it's 0.5 pound or 0.23 kilograms per 100 pounds of body weight or 45 kilograms of body weight. So that's the hard and fast rule of how much grain you should feed them. But again, at any one meal, you want to limit the amount of grain that will help prevent colic and laminitis, which we've already talked about. So we're going to jump a lot more into parasites next week, but you want to make sure you deworm them on a normal schedule to keep that parasite level down in the gut, and then avoid sudden changes to the diet. So the easiest for me to teach students or horse owners is what I call the 3-week rule. And you'll see some veterinarians and others will recommend doing it over 2 weeks, which is fine. But I think it's easier to remember the 3-week rule. So what you would do is the first week that you're changing their diet, you would feed them 75% or 3/4 of the old diet, and then introduce only 1/4 of the new diet. Okay, so you mix in, if you're changing commercial feeds or types of hay, mix it up, but keep 3/4 of it the old diet. During week 2, you go to a 50-50, 50% old, 50% new, mix it up, feed the animal for a week. And then the 3rd week, 75% of the new diet, 25% of the old diet. That way they're getting weaned over to the new diet. So that may take, a little bit longer than what some people recommend, and you can maybe shorten those to 5 days or what have you. But, if you do that, you're not suddenly changing the diet on the animal. So that's it for colic, and you know, you can find a lot of resources on the web, and also if you're concerned, always talk to your veterinarian or your medical professionals in your part of the world. So this is the end of week 4 with nutrition, and again, if you really want more, I cannot highly recommend Dr. Murray's class on Coursera. Just look at for equine nutrition, and there should be, you can put it on your watch list. It should be coming up soon again, and she really jumps into really the deep portions of nutrition. So just a couple reminders. Take quiz 4. You can go ahead and complete the feeding plan. Watch the feeding plan video. So we're going to go through and just kind of formulate a quick, easy diet. Shouldn't take you more than 30 minutes to an hour max on formulating a feeding plan for your animal. And these peer assignments, again, will ask you to peer review 3 of your colleagues, and that of the feeding plan will be due by the end of week 5. So that's it for nutrition. So next week we're going to jump into health, and then week 6 we'll get more into reproduction. So have a wonderful rest of your week, and I'll see you soon.